Welcome. Today we're delving into esophageal cancer, a disease affecting the tube that carries food from your throat to your stomach, the esophagus. Understanding this condition is vital for early detection and effective management. What exactly causes esophageal cancer? Well, it's rarely a single factor. The two main types, squamous cell carcinoma and adenocarcinoma, have different risk factors. Squamous cell carcinoma is strongly linked to tobacco and alcohol use. Long-term irritation of the esophagus, often due to smoking and heavy drinking, can damage the cells lining the esophagus, leading to cancerous changes. Adenocarcinoma, on the other hand, is more closely associated with chronic heartburn or acid reflux, a condition called Barrett's esophagus. Barrett's esophagus occurs when the lining of the esophagus is damaged by stomach acid, causing the normal esophageal cells to be replaced by cells similar to those lining the intestine. This altered tissue is more prone to developing into cancer. Other risk factors include obesity, a diet low in fruits and vegetables, and achalasia, a condition where the esophageal sphincter doesn't relax properly. Let's explore the pathophysiology. In esophageal cancer, the normal cells lining the esophagus undergo genetic mutations. These mutations cause uncontrolled cell growth and division, leading to the formation of a tumor. As the tumor grows, it invades the esophageal wall, potentially spreading to nearby lymph nodes and other organs. This invasion disrupts the esophagus's normal function, making it difficult to swallow. In adenocarcinoma, the process often starts with Barrett's esophagus. The cells lining the esophagus are altered, and over time, these altered cells can become cancerous. Who gets esophageal cancer? It's more common in men than women, and the risk increases with age. The incidence of esophageal cancer varies geographically. Squamous cell carcinoma is more prevalent in certain parts of Asia and Africa, while adenocarcinoma is more common in Western countries. Race also plays a role. In the United States, squamous cell carcinoma is more common in African Americans, while adenocarcinoma is more common in Caucasians. Understanding these epidemiological trends helps us identify at-risk populations and target screening efforts. What are the signs and symptoms? Difficulty swallowing, or dysphagia, is the most common symptom. This can start with difficulty swallowing solid foods and progress to difficulty swallowing liquids. Other symptoms include unintentional weight loss, chest pain, heartburn, hoarseness, coughing, and vomiting. In some cases, a person may experience bleeding in the esophagus, leading to blood in the vomit or dark, tarry stools. It's crucial to remember that these symptoms can also be caused by other conditions, but if you experience any of them, especially difficulty swallowing, it's important to see a doctor. How is esophageal cancer diagnosed? The process typically begins with a physical exam and a review of your medical history. If your doctor suspects esophageal cancer, they may recommend several tests. An endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, allows the doctor to visualize the lining and take tissue samples for biopsy. A biopsy is essential for confirming the diagnosis and determining the type of cancer. Other imaging tests, such as a CT scan, PT scan, or MRI, can help determine the extent of the cancer and whether it has spread to other parts of the body. An endoscopic ultrasound can also be used to assess the depth of tumor invasion. Esophageal cancer is primarily classified into two main types: squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma rises from the flat, scale-like cells lining the esophagus. Adenocarcinoma develops from glandular cells, often in the lower esophagus, and is frequently associated with Barrett's esophagus. These two types differ in their risk factors, location within the esophagus, and sometimes their response to treatment. Rarer types of esophageal cancer exist, but squamous cell carcinoma and adenocarcinoma account for the vast majority of cases. Treatment for esophageal cancer depends on several factors, including the type and stage of the cancer, as well as your overall health. Treatment options may include surgery to remove the tumor, chemotherapy to kill cancer cells, radiation therapy to shrink the tumor, or a combination of these approaches. Targeted therapy and immunotherapy are also becoming increasingly important options. For advanced cancer, palliative care focuses on relieving symptoms and improving quality of life. The best treatment plan is determined by a multidisciplinary team of specialists, including oncologists, surgeons, and radiation therapists. While there's no guaranteed way to prevent esophageal cancer, you can reduce your risk. Quitting smoking and limiting alcohol consumption are crucial steps, especially for preventing squamous cell carcinoma. Maintaining a healthy weight, eating a diet rich in fruits and vegetables, and managing acid reflux can help lower the risk of adenocarcinoma. If you have chronic heartburn or Barrett's esophagus, regular monitoring with endoscopy is essential to detect any precancerous changes early. The prognosis for esophageal cancer varies widely depending on the stage of the cancer at diagnosis, the type of cancer, and the individual's overall health. Early detection significantly improves the chances of successful treatment and long-term survival. Recent research is focused on developing new and more effective treatments, including targeted therapies and immunotherapies that are tailored to the specific characteristics of the cancer. These advances offer hope for improving outcomes for patients with esophageal cancer. Furthermore, there is research on developing better screening methods to detect early-stage esophageal cancer in high-risk individuals.